Breaking news right now. Indiana Governor Eric Holcomb addressing Hoosiers on the state's actions in response to the coronavirus crisis. Let's listen in.
Latest on all of our health indicators. You'll hear from the Commissioner of the Indiana Department of Transportation, Joe McGinnis, and you'll hear from the Superintendent of Indiana State Police, who will give us an evaluation of where we are out on the road and this upcoming weekend. But before we get to that and before we get to my comments, we'll hear from Dr. Box.
Thank you, Governor. Good afternoon, Hoosiers. Today we reported 581 additional COVID-19 cases here in the state of Indiana, which brings our total to 29,274 Hoosiers known to have COVID-19. We unfortunately saw an additional 38 confirmed deaths. To date, we have had 1,719 Hoosiers who have died of COVID-19 and another 148 who are believed to have died from this disease based on their clinical diagnosis. Our ICU bed and ventilator capacity are holding steady with about 39% of our ICU beds available and nearly 81% of our ventilators available. What this tells us is that our hospitals have the capacity to treat those who are severely ill with COVID-19. What it doesn't tell us is that the risk has disappeared, because it is not. We still need to wash our hands, wear our mask, and practice good social distancing to keep these numbers steady. We've also seen nearly 196,000 Hoosiers tested for COVID-19, up from 184,000 on Monday. Many of these individuals have come through our statewide testing sites set up through OptumServe. Nearly 15,000 Hoosiers have been tested through the statewide sites. Of those, 9,000 were negative, nearly 5,700 have pending results, and 466 were positive, for a positivity rate of about 5%. Launching an effort of this magnitude is always going to come with challenges, but we know there is a demand for this testing. We've been working closely with OptumServe to ensure that we are maximizing testing opportunities and to address some of the challenges that we've encountered. This includes things like shifting some locations to higher traffic areas across the state, improving signage at our testing sites, and expanding who is eligible for testing. We've also been working with OptumServe to provide additional boots on the ground. They've been very responsive and have sent an additional 40 nurses to Indiana to help with these efforts. Our goal is to also direct businesses with workers who might need to be tested to these sites whenever possible so that we can maximize the resources both at ISDH and through OptumServe. So if you have symptoms, you're an essential worker, are at high risk due to medical conditions like your race or ethnicity, being pregnant, or have close contact with a high-risk individual who you need to return to work, please consider getting tested at one of the 180 sites listed on our dashboard at www.coronavirus.in.gov. I also want to provide a quick update on our centralized contact tracing efforts. Nearly 2,800 cases have been entered into the system. Nearly 6,000 outbound calls have been made. We've received some reports of people claiming to be from the Indiana State Department of Health and asking inappropriate questions. I want to assure you that ISDH contact tracers are only asking for information related to your COVID-19 symptoms and the people that you've been in contact with. Your text message will say, "This is a message from the Indiana State Department of Health," and will provide the phone number to call. So if you get a call from someone claiming to be from ISDH who asks other questions, please let us know. And please respond if you do get a text or a call. Participating in this contact tracing is the best way that you can help protect yourself and those around you. Contact tracing is just one of the 4 guiding principles that we look at each day as we are slowly reopening the state. Just to remind you, the other 3 are: we monitor the number of hospitalized COVID-19 patients, we retain the capacity here in the state through our hospitalized system to be able to care for those most severely ill patients, and that we have the ability to test all Hoosiers who are COVID symptomatic. As you can see, hospitalizations for COVID-19 patients admitted each day has shown a significant decline from just 118 on April 14th to 53 on May 15th, less than half of that number. Also, hospitalization census of COVID-19 positive and suspicious patients has significantly declined from a peak of 1,800 to down about, that's 43. Indiana's daily testing continues to increase to approximately 5,500 to 6,000 per day, and that is key for us to be able to make sure that we can test any Hoosier that is a contact or has symptoms of COVID-19, and then we can contact trace those individuals. We've hired well over 500 contact tracers at this point in time with a capacity of 7,500 calls per day, and will continue to expand that as needed. We have thus far had 100% of our cases contacted within the first 24 hours. So now we'll give it back to the governor to talk about that transition from stage 2 to stage 3 here in the state of Indiana.
Thank you, Dr. Box, and all this that you just went over is exactly what has informed our decisions to date, whether it was in stage 1 or stage 2. Just to put this in context, we were in stage 1, that feels like it was years ago, but that started March 24th. Went to May 4th. So we were in that stage for 7 weeks. Remember, that was when we were just 10 people could assemble or could gather, huddle up with 6 feet between them. And then we entered stage 2 on May 4th, with the exception of Marion and Lake and Cass counties. Each with their own issues and numbers and indicators that we were following every single day. Obviously, we've been in stage 2 for 18 days, just over a couple weeks. And we've been, that maximum number was 25 people, so we more than doubled the number. We've earned the ability, I should say, the ability to continue to move forward. That's because people have been, by and large, for the most part, I always say 99%, have been paying attention to wearing a mask when you're in large crowds or close to folks, or that social physical distancing, that's 6 feet plus. Those things have really made a difference, and better hygiene and washing your hands for longer than you used to wash your hands. And so that's why we're able to go to stage 3, and we're actually able to go stage 3, and I say this with comfort and confidence, starting Friday. So 12:01 a.m. on Friday, when you wake up, when you go to bed on Thursday and wake up, Friday will begin stage 3. I'll sign that executive order tomorrow. We still have some items to make sure every T is crossed and every I is dotted correctly, but we'll sign that executive order, I will, tomorrow. That will take us to that 100-person bar, except for, again, Lake County, Marion County, and Cass County. Those 3 counties will be able to join stage 3 on June 1st. So they entered into stage 2 at a later date. And so as part of that gradual process, they will be able to all 3 join. Now, I say that because, as I've mentioned more than twice, it will ultimately also rest with that local control, that home control. Marion, Lake, and Cass may want to be more stringent than June 1st. So we'll cross that bridge when we come to it, but I just say that at the outset that they'll be able to join stage 3, those 3 counties, on June 1st. Also, in addition to that 100 number, restaurant and dining rooms will remain open at 50% capacity, but retail stores and malls, they will be able to operate at 75% capacity. Again, following all the guidelines, all the recommendations, all the restrictions that go along with entering stage 3. Gyms, YMCAs, fitness studios, they also may open come Friday with some restrictions. Community pools, campgrounds. Our state is proud of the fact that we are responsible for about 83%. This is 2019, but I've been up in northern Indiana enough to know that we're responsible for about 83% of the total American production of RVs. So this is, I know, of particular interest to not just that sector, but to the folks that like to get out on their own and see our great state. But campgrounds will be open come Friday morning. Recreational, underscore, underline, emphasize, put quotes around recreational sports practices may begin, again, following guidelines. Contact sports, such as football or lacrosse, those are still prohibited at this time. Basketball, tennis, soccer, baseball, fields and courts, they're going to be able to be open come Friday. Youth summer day camps also may begin on June 1 inside of this executive order, inside of stage 3. So just while most of stage 3 begins this Friday, youth summer day camps may begin on June 1. Raceways can begin competition with no spectators come stage 3 on May 22nd. State park inns are reopening as well, and they've used their time wisely to make sure that you can have a good, safe experience at our state park inns. Also, I should note that inside this executive order, again, that I'll sign tomorrow, that'll go into effect on Friday, we're extending the prohibition on turning off utilities, number 1. Number 2, we're extending the prohibition on filing mortgage foreclosures or evictions. And we're also waiving late penalties for certain B&B transactions. And they'll be extended to July 1st. So we're moving those days from basically June 4th to July 1st. We say all this, and I'm sure we'll have a few questions on it all, but this is all prefaced on the fact that, again, the number 1, 2, 3 things you can do, and I'm going to use my time of thanks to speak directly to you, because we all have a role in this, and the number 1 thing you can do is wear a mask when you're around a lot of other people, and you're in close quarters up on top of, around a lot of folks. A mask is going to go a long way. That physical distancing going to go a long way. Washing your hands, all those hygiene habits that we mention every single time we're together, those add up and make a difference, and that's what's allowed us. We've been successful to date because, again, by and large, most people are doing these things. So if you are 65 and older, or if you have underlying health conditions, we're still telling you to be uber cautious about surrounding yourself in an environment that could put you at risk. And just make sure that you're doing everything that you can, because this is about public health and our role in it. And so we've got to hold each other accountable. With that, I will kick it over to the commissioner at NDOT, Joe McGinnis. And Joe, we took a couple questions that were right down your strike zone, actually, and about rest stops, et cetera, and travel. And if you could give us an update, we'd appreciate it.
Sure. Thank you, Governor Holcomb, and good afternoon, Hoosiers. My name is Joe McGinnis. As he mentioned, I'm the commissioner, serve as a commissioner of the Indiana Department of Transportation. First, I'd like to start off by giving a shout out to NDOT employees and our continued collaboration with State Department of Health, State Police, National Guard, Homeland Security, Indiana Economic Development Corporation, and many others on the collection and distribution of much needed medical supplies and PPE. Since March 20th, these folks have worked tirelessly to collect, count, sort, and distribute from the Indiana National Guard warehouse facility out at Stout Field. As NDOT vehicles and staff are distributing supplies this week, we will continue to support the fight against COVID-19 here in Indiana for as long as necessary and continue to support the Indiana State Department of Health efforts. Meanwhile, in addition to supply distribution, NDOT has continued to execute our 2020 construction program with a new normal for our field crews, contractors, and consultants. As you can imagine, their jobs are extremely dangerous with or without a pandemic. However, they are now practicing social distancing in the field, virtual construction meetings, and paperless transactions, including electronic ticketing for material deliveries. We have also taken advantage of reduced traffic volumes, which I'll mention in a moment, to accelerate our projects. Notably, in the Indianapolis area, on I-70 from downtown to 465, on the east side has been accelerated with full and directional closures. The eastbound piece is complete as of last week, and the westbound piece will be completed this week. This reduction for this project has reduced this project timeline by 3 months and saved Hoosiers millions of dollars just on this one project. I-70 from downtown to the Ronald Reagan Parkway will be closed beginning Friday, May 22nd on the eastbound side and will reopen on June 28th. The westbound piece will close on June 22nd until July 30th. This was rephased in order to avoid disruptions to the new date for what we all can't wait for, the Indianapolis 500. I-65 at Keystone Avenue on the near south side is now also ahead of schedule. We are also able to accelerate 3 projects in Fort Wayne, 2 on I-69 and 1 on I-469. Additional patching occurred on I-65 in Maryville and now ahead of schedule on bridge work on the Borman, which is I-80-94, due to our ability to extend our work hours with fewer vehicles on the road. This theme continues all across the state of Indiana. Terre Haute along I-70 from mile marker 1 through 5. In southern Indiana in the Jeffersonville, Floyd's Knobs area along I-265 from 65 over to 64. And bridge deck clearing for 40 miles along I-65 in south central Indiana. All of these projects and many more were accelerated due to the graph you see here. Using the baseline of March 2nd through the 8th, we have continued to track daily traffic volumes on all Indiana highways. During the first few weeks of the stay-at-home order, we saw most traffic was down approximately 40% compared to the first week of March, with much more significant declines on the weekends. This is a great indication that Hoosiers were heeding the advice of the governor, Dr. Box, and all medical professionals. As you can see, Indiana has begun the process of getting back on track. The traffic volumes have slowly increased to just the 17% decline that we saw this past Monday. Weekend traffic continues, it's beginning to pick up a bit, but it's also continues to show a bit of a decline. But as the state opens up and weather improves, we expect that to increase. As many Hoosiers and possibly out-of-state visitors are traveling Indiana, rest assured we are taking all safety precautions at our rest areas as well. I know this question came up Monday, as you alluded to, Governor. So I'm here to answer that. And thank you, Dr. Box, for pinch hitting for me during that. NDOT currently maintains 29 rest areas or welcome centers around the state, 20 of which are currently online. The Batesville Welcome Center is currently closed due to construction on I-74, but all 28 open rest areas are now being cleaned hourly with the emphasis on common touch points, doors, handles, vending areas, and restroom fixtures. NDOT facility staff are also inspecting the facilities daily. For example, tourism brochures have been temporarily removed to prevent community spread. Just this morning, I spoke with Nick Barr at IFM, the leaseholder for the Indiana Toll Road up in northern Indiana, and he reassured us, me and NDOT, and I want to reassure you that they are also following the same safety protocols on the toll plazas and the travel plazas there along the toll road. Another unique program that I'm very proud of that didn't get a whole lot of attention, but we had the opportunity to provide a food service vendors at all of our rest areas for truck drivers who were in much need of a hot meal as they were driving extended hours across the country. We worked with the Indiana Motor Truck Association and Federal Highway Administration on this initiative with great success. During its peak, during the stay-at-home orders during phase 1, we saw 22 to 25 food trucks at any given point in operation at our rest areas. Today, those numbers are down. That's a good thing. We still have 15 trucks at various rest areas around the state, and we are in the process of phasing out that program as the state is getting back on track. With that, I would like to thank you for the opportunity to be here today with you all, and please all have a safe and healthy Memorial Day weekend.
Thank you, Joe. Also, we're going to hear from the superintendent of the ISP, the Indiana State Police, Doug Carter. Your world has changed as well, but you've been fanned out, as you are every day, across the state of Indiana. Can you give us an update on what's on your radar?
Yes, Governor, I will. Thank you for the opportunity. Good afternoon, everyone. And I know that there are so many facets of this pandemic that you've all experienced and are all thinking, and especially as we start to get back into our daily life through a very thoughtful process of entering stage 3. There are some good news stories, as the governor talks about so often, and I'm very pleased to report to you that just by limiting travel around Indiana and what you all have been willing to do, we have almost hit a peak of 22,000 less accidents this year to today than last year in 2019. There's a lot of reasons. There are many reasons for that. Number one is obviously that people are not moving like they did before. But number two, I really believe that this has changed behavior. And I hope that that behavior continues. As we move into the coming weekend, it's going to be a very different Memorial Weekend than ever before. And unfortunately, we won't be having a whole lot of activity out in Speedway, Indiana, but eventually it's going to come back. So I'm asking you to continue to think through what that might look like, what your driving behavior is like while going from point A to point B as we enter phase 3. We've had 25 fewer fatal crashes this year than we did last year, again, to today. And for those of you that have experienced that kind of sadness and sorrow, you know how much it matters. So thank you very, very much for that. Just over the Easter weekend, we had a 50% reduction in fatal crashes. This last Easter weekend touches many, many families, and it has a cascading effect on everything about us when those occur. As we start into phase 3, think about your behavior. Who's watching? Generally, those younger folks that are sitting in the car are watching you. I hope that you'll not drink and drive, of course, that you'll buckle your seatbelt, and as Joe McGinnis had talked about so extensively, and personally I love my partnership with him, pay attention to those work zones. They were they have always been very dangerous. Last year they were really, really deadly. So please, please, as you come into these construction zones, understand how dangerous it is for not only you, but for that worker that's in that zone. And finally, remember on July 1, we're a hands-free state. So there's no better time than to change behavior than now. And maybe dropping an old habit and picking up a new one, not literally, but maybe now is the time to do that. I can tell you that I'm working at it, and I hope you are as well.
Thank you, Superintendent Carter. And with that, will Rachel just jump right to the Q&A?
Sherry with the Indianapolis Star.
Good afternoon, Sherry.
Good afternoon, Governor. Good afternoon, Dr. Box. I have 2 questions. One is about the long-term care facilities. I know the state's AARP yesterday asked you to release the names of long-term care facilities where COVID-19 deaths and cases have occurred. The federal government has said it will begin releasing facility-level data by the end of May. I was wondering, who are you protecting by keeping the information hidden from the public at this point? And my other question is, what is happening up in Elkhart? I know you've had some testing sites up there, but for the past, say, 5 days, Elkhart has seen one of the highest numbers of new cases in the state. So I didn't know if that was an outbreak in a community or if you knew what was going on.
I'm sorry, I don't know specifically what's going on in Elkhart. I do know we have a large number of testing facilities up there, and that may just be contributing to the fact that we are testing so many individuals, but I'd have to look directly at those numbers, Sherry, and I can, and I will get back with you on those. With regards to long-term care facilities, I'm not trying to protect anybody. What I am trying to do is emphasize the importance of that communication occurring between the facility with the residents and with their representatives, and have continued to support that all along as being the most important communication. That being said, if CMS publishes this data and information, I support that totally. We have very, very closely followed every CMS regulation, recommendation, guideline that has come out, and we will continue to do that, and are working even with the most recent CMS guidelines that came out talking about how to reopen some of our long-term care facilities. So we are very much every day in the process of making sure that we follow those guidelines carefully.
Sheila, WLKI.
Good afternoon, Sheila.
Good afternoon, Governor. How are you?
Fantastic. Yourself?
I'm wonderful. So my question today is a little bit about football and contact sports. With opening sports practices back up later this week, I know you mentioned that certain contact sports such as football are still on standby. However, once you sign your executive order, do you anticipate that the IHSAA will at least let contact sports conduct open practices that allow non-contact training and skill building, such as organized weight training? And along those lines, will the IHSAA be revamping their plans for summer practices based on your new executive order?
No, I mean, we've been meeting, and Katie Jenner's making her way up to the podium, but we've been meeting with the Department of Education, with Superintendent Jennifer McCormick, Dr. McCormick, on just this. So it doesn't, our executive order doesn't contemplate at this time those school buildings and facilities reopening. So that's still off in the distance. We're working on that. We're making progress. But you want to speak to the ISHAA and maybe their reaction?
Sure, I'd be glad to. I'm Katie Jenner, Senior Education Advisor for Governor Holcomb. So a couple of things, just to echo what Governor Holcomb shared. We continue to work diligently with the Department of Education and the State Department of Health, reviewing the most updated data and research in the development of comprehensive guidance for our school leaders, and we will get this guidance to our school leaders just as soon as possible. After speaking with Superintendent McCormick on this specific issue, the decision was made to keep schools and facilities grounds closed for anything other than what will be listed in the executive order. As Governor Holcomb shared, he'll sign that tomorrow. And then with regard to IHSAA, we have been on frequent calls with them. I think they've already issued some guidance post June 30th, and we will continue to work with IHSAA just as we are with other associations as we think about how reentry might look for our schools. It's going to for sure be a comprehensive look. The other thing I will add is just a quick thank you. We have had so many educational leaders, principals, superintendents reach out directly to our office with your ideas, with your insights. That has been invaluable to this process and thinking through the various scenarios we might face come reentry. So again, thank you for the question.
Yeah, and I'll just follow up that this is and remains something that the Department of Health and the Department of Education, our office, we got to get right. And this is somewhat unique because not just about the sports part of your question, Sheila, but especially about the instruction part of your question. Understanding that we've got transportation issues to deal with, we've got nutrition, food service issues to deal with, and then the instruction. Some schools can do certain things, some are limited by space. So we want to make sure, as Katie said, we're getting all the input and that final direction is dialed in.
Erica Irish, the State House File.
Good afternoon, Erica.
Good afternoon. Thank you for taking my question. Sure. So earlier, I believe the Secretary of State, Connie Lawson, mentioned that more than 330,000 Hoosiers have already casted their vote by mail, up from 53,000 in the 2016 election. As that application deadline nears tomorrow, do we have an updated number on how many have voted by mail? And what are we doing to ensure that people receive ballots in time?
I will, Erica, have an update for you Friday. I don't have that on the top of my head, but I will. I've got the Secretary of State on my speed dial, so I'll find out and we'll get you that information.
Abigail with the Brown County Democrat.
Good afternoon, Abigail.
Good afternoon, Governor. Can you hear me?
Loud and clear. Thank you.
Excellent. So Brown County is home to 8 residential summer camps, and you said that day camps were going to open on June 1st. But our local health department is wondering how the state, if they have any more guidance that we can pass on to those camps beyond what the CDC has already put out.
We have been working on local guidance for day camps, not for overnight camps at this point in time, which we're not ready to open at this point in time. And really that is to do as many activities outdoors as possible, to provide a boxed type lunch rather than a congregate setting where everybody goes through a line and gets food, to make sure that we do the same type of investigation as to whether an individual child is sick or has any signs or symptoms of COVID-19, to do the social distancing as best we can with children, but we know that kids don't always do that very well. And even have discussed the opportunity to wear masks in some of these situations, especially at times when they do come together. Again, children don't always do that extremely well. I don't know, Dr. Sullivan, did you have any other things that I've mentioned on that? Okay.
She gave you the double thumbs up. But I will say, just this reminds me, in going through the Back on Track plan, which I'll sign the executive order tomorrow. It will be public tomorrow, starts on Friday. But also our Back on Track plan, this guidance, will be finalized and it will be posted. And I would recommend you go there tomorrow, because there are, I mentioned pools, and as I was thumbing through that, there were 7 pages on guidance and restrictions and recommendations. So there is a very lengthy amount of information to help guide you through as you safely come back online.
Tom Davies, The Associated Press.
Afternoon, Tom.
Hello, Governor. What is Indiana's plan for being able to test all nursing home residents and staff by next week, as the White House is recommending? And will that be done on a regular weekly basis afterward?
Yeah.
That's an excellent question. We have reviewed the guidance that has come out from CMS and have been discussing that with our long-term care facilities and their associations. As we mentioned, that would be over 100,000 individuals by the end of the month, and I can assure you, unfortunately, that is not going to happen, but we are working to make sure that we are testing all of our employees of long-term care facilities, and that we have the opportunity to either connect them with Optum sites, or to actually do that testing in the facilities for them, or to be able to provide them with the test kits, so since there are nurses within their own facilities, for them to be able to do that testing. The frequency of that remains to be seen, based on some more information I think that we'll hope to see come out from the CDC and further guidance from CMS with regards to that.
Ryan, WEHT.
Afternoon, Ryan.
Hello there. So I've got a 2-part question for y'all.
All right.
Number 1, we've got the Indiana primary coming up. Do you have data as to how many voters have requested a mail ballot so far?
Ryan, I will send you will be on an email with Erica. I don't on the top of my head, but I will later today.
All right. And the second part of that is Michigan Secretary of State announced that they are sending out applications for mail ballots to all of the voters there. President Trump criticized that decision. Is Indiana considering a similar measure?
We have not statewide.
Okay.
Thank you.
Travis, Wish TV.
Good afternoon, Travis.
Good afternoon. I just want to know what makes you so confident in stage 3, and then as we look a couple weeks ahead to stage 4, do you have the same confidence that we're going to make that June 14th date?
You first.
Well, the data makes us very confident to go into stage 3 right now. The Hoosiers have done an amazing job with the non-pharmaceutical interventions, which people laughed earlier, but that's basically what you've been doing with social distancing, wearing the mask, and washing your hands. So as the governor said earlier, you deserve to go to stage 3. Do we have that same confidence of going from stage 3 to stage 4 as we look at what some other states have done and we see the results of their increasing tests, as we look at kind of this additive effect of numbers of positive tests and individuals that may be hospitalized, and as we look at some of the more recent data that's coming out about how you make a decision today and that you really don't see the effects of that start for about 7 days, and then really beyond that it may take another 10 days to 2 weeks to see truly what that effect is on hospitalization of patients and use of facilities such as ventilators and ICU beds. So I have a little more concern about that transition from 3 to 4, but we'll be watching the data on a daily basis just like we have been.
Yeah, and I'll just get real here. I would say this. That's why I said write down June 14th in pencil. I know it's going to be on the website. We've got June 14th there. That's our marker. But this kind of reminds me every day when someone tells you this election's the most important election in your lifetime. Happens to be true because it's this one. And we're in this stage right now, stage 2. And stage 2 is a very important stage that got us to stage 3. Stage 3 will be just as important to stage 4. And it will determine if we get to stage 4, when we get to stage 4. And that has a lot to do with everything that we're not just investing in more testing and expanding that, who we're testing, how frequently we're testing, our surge plans getting into nursing homes or wherever population density calls, those caseloads, or the tracing and those efforts to be able to then see, we're going to learn a lot in stage 3 just by the sheer number. We're quadrupling a number of people that are going to be able to come together. And so it does give us, Travis, some concern just knowing that we're going to be in this stage until June 14th in all likelihood, with that number of people and that amount of activity. But we're confident because of Dr. Box mentioned the outcomes of all of our investments. But to answer you honestly, this is a TBD. This is a to be determined. We have put June 14th out there, but we don't know, and we won't until we go through stage 3.
Rob Burgess, the Wabash Plain dealer.
Good afternoon, Rob.
Good afternoon, Governor. Commissioner McGinnis, I wanted to ask about the status of the proposed US 24 median U-turn project in Wabash County. The last I heard of this project was in December, and NDOT had agreed to another study, but the start date of the project was still set for spring. What is the current status of the study, and given how controversial the project was locally, combined with everything else that's going on with the virus, is this project still a priority for NDOT?
Yeah, so great question, and thank you for asking, and we'll give Dr. Box a break here with the questions. I am familiar with this. I have worked with some of your local legislators on this specific project. We did do another independent study, another engineering firm this past winter, looked at that project, came to us with the J-turn of reduced conflict intersection concept again, the different firm, but they came back with that with some additional enhancements for safety. It is a priority just because that last word I just said, safety. All safety projects that we have in the state are of the utmost importance to us right now. Regardless of what our revenue situation may be, safety projects have to be job number one. And so we are continuing on with that project. I have had multiple meetings with the legislators from the area, and provided the most recent study from the engineering firm on that particular project.
Can I put you on the spot here? Rob asked a question about the project in the Wabash area, county area. How many projects do you have going on in 2020 right now?
A little over 1,100.
Lindsay Erdody, the Indianapolis Business Journal.
Good afternoon, Lindsay.
Good afternoon, Governor. I was wondering if you could comment on when casinos and the off-track betting facilities might be able to open, if you've given any thought to that.
We have.
That is something that we would expect nothing before stage 4.
Yeah.
I'm assuming with that, as we've talked about sports and entertainment. Obviously, you know that is a very close space with a lot of people touching the same surfaces, so that is a little more difficult.
Yeah, Lindsay, and just to repeat, it is being contemplated in stage 4. That's where we remain. I will say that we're very appreciative, just like working with individual schools and superintendents and principals and teachers, or working with the hospitality industry. The gaming industry has been very helpful in showing us how they can operate in a safe manner. So to answer your question, it's still off into the next stage.
Kathy, the Ferdinand News.
Hello, Kathy. Good afternoon.
Good afternoon. So nice to talk to you.
You as well.
I'm in an area with a lot of small towns, and they're all struggling a little bit with their playgrounds. Yeah. One of the questions is it safe for children to go on playgrounds? Because there's no way they can clean them constantly in between. What do they need to add in the parks and things to open them up and feel safe? Because they don't have the kind of staff that a city would have.
Yeah, they're thinking right, and we're just not there yet. You want to talk about?
The biggest problem is the number of people that touch those surfaces, right? And children oftentimes put their hands to their mouth and to their face, and that's a very difficult thing to manage. So we are just not there yet with that. If we could, work with our children to continuously clean their hands and keep their hands out of their face, but I couldn't even keep my kids from eating dirt when we were when they were little. So that's an issue that we've really worked on, and I know will come, but we're just not at that point yet.
And that, Kathy, is mentioned in the Back on Track plan. It'll be posted tomorrow, but very specifically about playgrounds.
Brandon Smith, Indiana Public Broadcasting.
Good afternoon, Brandon.
Afternoon, Governor. I wanted to start by asking how many mail-in ballots the state has received. I'm just kidding. I actually have
Can I copy you?
Yeah. I actually have two questions. First, for you, Governor, now that we have a pretty good sense of what the race looks like for the Republican nomination for Attorney General, which candidate will you be backing? And then, Dr. Box, I wanted to ask, do you, as a medical professional, do you really think it's safe for 100 people to gather together in a group starting in 2 days?
You want to take that one?
Start? Sure. So I have concerns and reservations about every step and every change we make. That is a normal thing. I wouldn't be giving it the appropriate evaluation. However, I do think that there is a way that we can do this safely, and that involves all of the same things that we've already been doing, and that is social distancing, washing our hands, wearing our masks. As I said, my mask protects you and your mask protects me. And I would strongly encourage gatherings that large to be outside, because we know that that is a protective effect, being outside in the open air rather than in a small enclosed space. But of course I have concerns about it. I worry about this, as I know the governor does, on a regular basis.
Yeah, I would say, Brandon, you didn't ask me, but I'll tell you what I think. We got to do 5 things. We got to slow the spread. That means me, you, everyone. That means as an individual, that means as a business, everywhere we live, work, and play in the state of Indiana. The better we all do that, we'll be able to get through this as safe as possible. We have to know where the spread is or where the cases are. We have to continue to test. We have to trace. We have to follow where these cases are. We have to be able to care for those, number 4, care for those who are in need of care. And that's why we report on our level of PPE, our ventilators, our ICU bed availability, and our capacity. This is something I'm really proud of in the state of Indiana. We came out of the gate at the very beginning of this, and our hospitals came together like one. We always talk about in this together. Our hospitals proved it from day one. And this has, quite frankly, separated us from the pack in many respects. And then we have to hold ourselves accountable. We have to measure the outcomes. We don't erase an answer if we don't like it and fill it in with something we do. We deal with the facts, and we're, like I said, we're very transparent about that. In terms of who I'm going to back in another race, I'm going to back the delegates because they will decide.
Brock Turner, WTIU.
Good afternoon.
Good afternoon, Governor. Question for Dr. Box. I just wanted to follow up on an earlier question about long-term care facility level data. I know that you've mentioned that the state wants to stress the conversation happen at the personal level, but I'm wondering what your response is to individuals, several of whom who have reached out to our newsroom saying that facilities aren't giving them the data even after they request it. And if the state's already collecting it, wouldn't it just be easier to release that for families? That way they don't have to have that conversation.
I think that is something that we've addressed multiple times here, and that is something that we need to know about. We want you to contact us, and we have specifically a way for you to do that at familyoutreach.isdh.in.gov, and then we personally are looking into every one of those. I can tell you that I receive emails about this, and I give it specifically to the head of our long-term care regulation department, and we look into every single one of those and actually make sure that those individuals get any information that they feel that they have not been had released to them.
Eric Berman, WIBC.
Good afternoon, Eric.
Good afternoon, Governor. I wanted to back up to an earlier question to clarify. Dr. Box, I think you said that you wouldn't be comfortable going to stage 4. Are you saying that you wouldn't be comfortable if you have to do that right now, but that may change by June 14th? Or do we need to hit a higher standard than we're at now to be able to make that next move up?
I think I'd be very happy if we're able to maintain where we are right now, and if those statistics and numbers stayed exactly the same. But if we start to see that creep up, and then I have concerns about this additive effect happening with more positive cases across the state. The good news is I've seen the positivity percentage go down. Our overall positive percentage for individuals tested has been overall from the very beginning about 15%, but our most recent days have been down around 10 or 11%. I'd like that to stay down in that area. And again, it may be looking at specifics, community by community or county by county, as we look at this region-wise across the state.
Nikki Kelly, the Fort Wayne Journal-Gazette.
Hello, Nikki.
Hello, Governor. Sort of related to the casino question, I've had some people from the charity gaming industry reach out to me. One person wants to know why bingo halls can't open if they keep the number below 100 people and 6 feet apart.
Yeah.
That may be a part of our gaming industry. I guess bingo would be considered that. And so basically, I think that we would tend to open those at the same time that we do our other gaming industries. I do think that the same social distancing that we require and not touching and handling the same things is going to be really key. So bingo cards and other things that would be used would be important to not have that be something that could spread the disease.
Yep.
Whitney Downard, CNHI.
Good afternoon, Whitney.
Good afternoon. My question is also on long-term care facilities. We were talking previously about having state-level data, regional data on healthcare workers infected, and you spoke about some of the difficulties getting those numbers, but we haven't heard any update on whether or not we're going to get those numbers. And is it possible that the long-term care facility information can be updated more frequently than weekly? I know you mentioned that you wanted to update it more frequently than weekly when you initially released it.
So we do work to update that. We like to keep some of our major updates, like our hospital information, our long-term care facility, and other things done on a weekly basis, just like we report out on our information about race and ethnicity. So we want to keep doing that on a weekly basis. The other part of your question, I'm sorry, I kind of...
So just healthcare workers who have been infected with the virus, specifically at long-term care facilities. That used to be something we were supposed to get, and I haven't heard any update recently.
So we can ask the team to try to break that down further. Healthcare workers don't always get tested in the same way that the residents get tested. So that's not always through our strike teams. They may go out and individually get tested at Optum or with their own local healthcare provider. So consequently, I may not have that information show up in my data.
So the state isn't tracking what long-term care facility health workers are getting sick or tested, or they're not keeping that all in one location?
We do if we do the testing. But what I'm trying to say is that there are individuals that go out and get tested on their own, and there's no data that comes back as a test is reported that this is a worker who is employed at a long-term care facility. Anytime there is a case and we go in and do the testing and test all of the employees in that, then that information we do have, and we do gather that information. And going forward, our goal is to test every employee of a long-term care facility, I'm hoping by mid-June.
Andy East, The Republic.
Good afternoon, Andy.
Good afternoon. Can you hear me?
Crystal clear.
Okay. Thank you for taking my question. My question's for Dr. Box. On Monday, you had announced that the first case of multi-system inflammatory syndrome in children. And I wanted to ask you if the state plans to look back maybe at other cases of children who may have been hospitalized with symptoms consistent to the syndrome over the past weeks and months. And do you think that maybe it's possible that there could have been more than one case of this syndrome, but maybe doctors weren't quite aware of the condition at the time?
I think that is an excellent question, just like knowing that we had some COVID-19 cases before they were actually reported as COVID-19. Our hospitals that deal with our more critically ill children cases in the state, I know, have investigated and looked back at some of those. We have reviewed a couple of additional cases here in the state that did not actually qualify as being the MIS-C diagnosis or definition from the CDC. So to date, we still just have the one case.
Abdul Hakim Shabazz, Indy Politics.
Good afternoon, Abdul.
Good afternoon, Governor. Good afternoon, Dr. Box. Good afternoon, Joe. Dr. Box, a question for you, then Governor, one for you. Is there any way we could get a breakdown of deaths that have occurred in nursing homes versus comorbidity in our total number, sort of a breakdown that way? And number two, Governor, the question for you would be, is there, as we move through the different stages, is there anything that we've done so far to say, hey, you know what, that's probably a good idea to keep going forward, like not having a reason to do mailing by absentee, whether it is pick up alcohol at the curbside, anything that you may have seen so far that may be worth exploring going down the road.
I just want to clarify your question. Is there a way to get more information about the deaths from the nursing homes with regards to comorbidities? Is that the question that you have?
No, just how many out of the deaths were nursing homes versus how many were had a comorbidity out of that total number, if that makes sense.
I don't think I'm understanding the question. I'm sorry, I'm not trying to be dense. I do know we have total deaths in our facilities of 732.
No, just basically, was there any way to, out of, like, for example, of the 17, 16 total deaths, how many were nursing homes, how many were comorbidity, that sort of breakdown? Or is that possible at all?
It may be. I just don't understand the question. I apologize. If you will send that to Rachel, I will try to directly address it to the best of my ability.
No problem, Dr. Box.
I don't think anybody's going to accuse you of being dense, okay? Come on. Yeah, maybe Abdul, but not you. No.
Thanks, Eric. I appreciate it.
Yes. Look, we look at this in stages and on a day in, day out basis. And I think the only thing that concerns me, and I hold myself accountable for this too, so I'm not trying to be holier than thou, is as time goes on and as we effectively and successfully manage our way through this, live through this, and do all the things that we're here to do, and that's to help people at home, whether they're unemployed right now, bridge this time, or help people, at work through the upgrades that are happening in our workplace, or help people who are suffering and struggling and in the dark right now, not knowing what tomorrow is going to look like. What I'm most concerned about is how we're connecting with each of those tasks and those individual people. And then how we as the public are conducting our affairs. This is a public health issue that comes down to individual personal responsibility at the end of the day. And all the regulations and all the guidance and recommendations that we put out there, ultimately it comes down to people's personal actions. And what I don't want to see happen is we let our guard down, or we're not vigilant, or we think, well, it's just, they say this is the most important week every week, and so therefore it can't be. Well, it is. And our actions matter. And so as time goes by, I hope we don't let down our guard, because what will happen is when we prove that we can successfully live through this and get to the other side, and we don't know how long that's going to be. That's the frustrating part for everyone, is what happens in the fall, et cetera, et cetera, et cetera. But I can tell you, we are prepared for this right now. We have a plan in place. I went through the 5 steps, but I just don't want it as it gets in our rearview mirror for us to let down our guard. That's what I'm concerned about. And that's what I'll be concerned about in stage 3, I'll be concerned about in stage 4, in stage 5, and when we add 6, 7, 8, 9, and 10. Go ahead.
Our final question is from Meredith with WLFI.
Good afternoon, Meredith.
Hello there. Last but not least, right?
Last
All
but
right.
not least.
All right, so my question is in regards to testing in general. So a lot of other states have opened up testing to individuals who are asymptomatic, or if they just want to get a COVID-19 test, they can. Is Indiana considering doing this, especially with that Fairbanks study that came out where 45% of people who tested positive were asymptomatic?
We have certainly had discussions along that line and have opened our testing up very, very wide, where if you go to most of these places, you don't really have to verify why it is you're there, but you can be tested. Some of them have tighter restrictions than others. At this point in time, the cautionary concern that I have about that is, again, if you're asymptomatic today, you haven't been exposed to someone with this, you haven't had a particular symptom that makes us worry that you've had this, for you to test negative today is really just that snapshot of that moment in time. And so for you to go forward and conduct yourself any differently would be really, really wrong and dangerous for people around you, because we know the number of individuals by our study, 45% of people who tested positive were asymptomatic. So I think it is really critical that we conduct ourselves like we feel like we're infected, and that will be more protective of those around us.
Yeah, and this is such a contagious virus. And that study said that 186,000 predicted have it. So we're a state of 6.7 million folks. So this is still on the loose.
Thanks for joining today's briefing. Governor Holcomb's next briefing will be Friday.
And you've been watching Governor Eric Holcomb's update on Indiana's coronavirus response. More than 1,700 Hoosiers have now died tragically of COVID-19. The total number of deaths in Marion County has now topped 500. We heard the state officials say that the risk from COVID-19 has not disappeared. We did get an update on the testing that's been done in the state in conjunction with the OptiServe company. There has been a lot more testing done in Indiana throughout those various sites. We heard a warning about contact tracing. There have been scams that we've reported on as well here at CBS 4. If you get a call from someone claiming to be from the state, let the state know, because they will be contacting you through text message. Also, we heard that hospitalizations have gone down in Indiana, but the main headline out of this briefing deals with stage 3 of the state's reopening plan, the governor's reopening plan. That has been moved up to this Friday. In 2 days, stage 3 will be in effect for much of the state, the big exception obviously being Marion County. The stage 3 does mean in much of the state that groups of 100 people, them meeting, them gathering, will be allowed. Again, this is except for Marion County. Gyms can reopen. Restaurant dining rooms can reopen as well. The governor and Dr. Box saying that Hoosiers have earned the ability to move forward, but the governor stressing that this is not a time to let their guard down. They did say that the numbers, the data that they have received, did allow this moving up from Monday now to Friday for stage 3 again for much of the state. But they did say that it is a matter of staying within the guidelines as well. No word on whether or not stage 4 will also be moved up as well. They say that's going to be because of the data coming in at that time. We heard from the Department of Transportation saying traffic volume is up. They do expect that to continue as the state opens up and as we move into the summer. Also, many questions about the state's decision not to release specific numbers on nursing home and long-term care facilities, how many cases they have had. They defended that decision once again, but did not give a clear reason as to why. Much of that information is now being released from federal sources, specifically from the Centers of Medicare and Medicaid Services. State officials saying that they will not be able to test all residents, as the White House guidance has suggested, but they will be able to test more staff. A lot to get to from this briefing. We'll have much more on those updates from the governor tonight on CBS 4 News at 5 and 6, and right now on the CBS 4 Indy News app. For now, we'll head back to our regular programming.